Dr. Bhavna, anything to chip in, to add uh, your experience of the kind of patient you're getting? We are all aware of all cancers rising with age and, in fact, all problems. But since we're getting younger cancers, so that's why this age we are discussing. So your thoughts on it?
Thank you, Dr. Chintamani, and thank you, Week, for organizing this event because it increases awareness, and the whole point is increasing awareness. So I agree with all the panelists. I'll just put in a word that I have worked in all corners of India, north, south, east, west. And my perception is that we are seeing more and more younger women in their 20s and 30s who are being diagnosed with cancer, with breast cancer. And I think that could be related to the younger population dynamics that we have in India as such, and also to the fact that the infection-related cancers are going down, the lifestyle-related cancers are coming up, and also women are becoming more aware, and they are actually going for checkups and tests as well, which is how we will change the dynamics of, stage 3, 4 to stage 0 and 1. Thank you.
There are aspects of diet which we all understand are in general good for everybody, but anything specific to breast cancer that you would like to enlighten us about?
So there are a lot of studies actually which have been done on diet and breast cancer. And there is some evidence to show that vitamin D, can help breast cancer cells to grow normally. And, our Indian diet and the sun is very enriched in that. There have been some papers about low GI diet. There have been papers about processed foods and sugar intakes, especially refined sugar. The recommended maximum in a day is 30 grams per day, So all of these have been implicated in making the cancer cells grow and increasing the risk of breast cancer. So I think it's very important that we follow a healthy diet which has enough of fruits, vegetables, and adequate amount of protein, carbs, and fats, the good fats. One should avoid the saturated fats. There are quite a few studies on diet and low fat diets decreasing or the incidence of developing breast cancer. Or in women who have breast cancer, there is evidence that, those ladies who followed a low-fat diet, the risk of recurrence was also lower. So I think diet has a very, very important role to play in this. If you permit me, Dr. Chintamani, I just have one thing, this ABC of prevention,
Yeah, please.
It's easy for people to remember.
Yeah, absolutely.
It's avoid tobacco, alcohol, OCP and HRT long-term use, processed food, supplements and sugar. Be breast aware for B and breastfeed. C is for calm, compliance to your checkups and yoga. D is diet, which is again, the most important component. E is exercise. And again, you already elaborated on that. And we have enough evidence to show for breast and colon cancer, the lifestyle related diseases, that exercise is so important. Something that gets your heart rate up, not just, simple walking. F is for family history. I feel you should know what your family history is and follow up. If you're recommended a test by a doctor, you must follow it up. S is for sleep. There is enough evidence to show, big Spanish study, that, if you have 2 hours between your last meal and sleep, or, you have your meals before 9 p.m., there is a 20% reduction in breast and prostate cancer, which are called shift-related cancers. And S is sweat. You should sweat. You should really exercise so you sweat. You should stretch. You should also undergo screening, which I'm sure you will discuss.
Yeah, sure. Thank you so much. That's wonderful. You put it down and you can hear some people were trying to clap, but they probably thought it is prohibited. You can all clap, no issues. I think your ABCD did it, but if you can...
One last thing, there is a lot of data coming out, which I agree with it without presenting it, is that, not only this 30 minutes of what you suggested, brisk walking, but what is also simple to do is muscle strengthening exercises. Because you do this, but you do yoga and also maybe put in 10 minutes of muscle strengthening exercises, because that also produces different kind of dynamics in the body, and there is data coming that it prevents cancer and also helps cancer women or men to tolerate treatment better.
Thank you.